The Country Health Status Report of Mexico. Cultural Assessment Paper for Nursing 310. The student's name is Ruthie Millar. The professor is Ashley Lee, RN, and the date is April 20th, 2023. The introduction. The country of Mexico is located on the southern border of the United States. Mexico is known for its rich cultural indigenous heritage, its long-standing ties to the Catholic Church, and its beautiful landscape and topography. Mexico boasts many areas that are tourism-driven, which is a benefit to the local economy. The Mexican people have a collective family framework and value family ties and time together. It is common and accepted that families will take care of each other in times of need. This is often over other forms of care, such as hospitals or long-term care facilities. This is especially helpful in times of need or if a family member has a health issue. Unfortunately, Mexico is rife with high rates of disease and non-communicable diseases such as diabetes and heart disease. This is especially true of citizens who are impoverished and lack the accessibility of quality health care. While Mexico is a democratic nation and is listed by the World Bank as an upper middle income country due to a concentration of foreign manufacturers that tap into the hard work ethic of the Mexican citizens, it is also a nation of the haves and have-nots. This also plays an important role in the overall health of the country and the burden of disease, which has increased dramatically over the past few decades as more and more Mexican people have an increasingly sedentary lifestyle. The health status of the country of Mexico will be the focus of this PowerPoint. The population health status and health problems in Mexico. The root cause of the health issues of the Mexican people is obesity. The level of obesity and sedentary lifestyle is a leading factor in the overall burden of disease in Mexico. From this high level of obesity stems a multitude of non-communicable diseases such as increased rates of diabetes, kidney, and heart disease. These diseases have several contributing factors such as a much higher sedentary lifestyle, as well as lack of regular exercise or physical movement and lower nutritional intake due to the consumption of ultra-processed, prepackaged foods as well as sugary commercialized beverages. To look at the country's complete health standing, one must consider the components that are entailed in the health status. These include economic stability, education, social and community environment, and access to health care. All of these factors contribute to the health of the citizens of Mexico. The population of Mexico as of 2019 was just under 125 million, and of that, almost 50% were diagnosed with diabetes, which is the leading cause of death from disease. This non-disease related leading cause of death in Mexico is personal injury from interpersonal violence. In a reverse trend, the rate of infant mortality has decreased, but so has the rate of fertility. The high rates of death from disease are also impacted by the lack of quality health care, which varies according to income level, employment, and accessibility. The lifespans of humans overall is longer than it ever has been. However, Mexico is seeing shorter lifespans due to more disease. The burden of disease is an ever-increasing factor in the country's economic stability and how it can best continue to provide health care to its citizens that are coping with diseases that can lead to DALYs or disability-adjusted life years. Here are two tables supporting the statistics of slide 4, this prior slide. Both tables were found at Health Data 2023. The table on the left signifies what causes the most deaths, which you see is heart disease, diabetes, chronic kidney disease, and several other factors like COPD and the interpersonal violence. Those for the diseases, communicable, maternal, neonatal, and nutritional diseases. The cause on the table on the right, what causes the most death and disability combined, as you see number 4, the dark green bar exceeds 50% of deaths in Mexico, and that is interpersonal violence. The overview of the healthcare system of Mexico. According to Mexico, a health system review, Mexico has a health system that is divided across varying public and private payers and providers. Until 2020, coverage for the uninsured was maintained by both state and federal providers, while social insurance was provided by centralized and national institutions. In addition to these, the private sector operated independently but still upheld regulations mandated by the government. There is also a subsystem of social insurance which is upheld by three dominant national institutions that provide coverage for all employed and salaried citizens working in the formal sector. The IMSS covers private sector employees, and the Institute for Social Security and Services for State Employees, ISSSTE, covers federal government employees. In 2017, IMSS covered about 33% and ISSSTE 7.4% of the population, respectively. Both IMSS and ISSSTE organize, provide, and regulate most of their own health services through vertically integrated national organizations. Despite being provided with state and federally funded healthcare, citizens still opt for other healthcare coverage to gain access to higher quality healthcare versus the standardization of socially provided insurance. For those that are not formally employed or do not have access to health coverage, the Ministry of Health also provides healthcare and specialized hospital services to the underinsured. Healthcare expenses continue to climb in both the public sector and the private sector, resulting in higher out-of-pocket expenses. Mexico, like many other Latin American countries, must work diligently to reduce their national burden of disease and increase their health standards, which will increase the overall health of their country. The comparison of the health status and the health system of Mexico with the United States. The health status of the country of Mexico is in alignment with that of the United States. Both countries have high levels of obesity, diabetes, and heart disease. Mexico comes in second to the United States, with citizens struggling with poor health and the diseases that accompany poor nutrition choices and sedentary lifestyles. In the U.S., life expectancy is declining, and while Americans spend more than any other country on health care, it leads the world in deaths by preventable disease. The U.S. also had more deaths from COVID-19 than any other advanced nation. All these detrimental factors culminate in the fact that the United States has fewer and fewer primary physicians, which results in less access to quality health care. In addition to the burden of disease in America, there is a much higher risk of death by physical assault, which includes gun violence. Even with the 2010 introduction of the Affordable Care Act, ACA, many Americans cannot afford health care. The United States is the only country that does not offer universal health care to its citizens. It is up to the individual citizen to find health care options and plans, and most do this through their employer. The healthcare system in the United States is flawed, but the country is seeking ways to reverse the trend, including investing in more primary care physicians, which makes a positive difference in overall consistent health care. Recommendations for improving health in Mexico. To improve the health in Mexico, there are several factors that must be recognized and addressed. Mexico is a country steeped in pride and tradition, one that Maritza Gone Onet, RN, and Yele Oleo, BS, ACSM, and CEP are both proud to call their native country. In several assessment interviews about their lives in Mexico and what aspects they would improve from a health perspective, they made the following recommendations based on their formal health-based educations and personal experience. Ms. Onate stated education and women's health were key to improving the overall health status of Mexico. The culture of Mexico is matriarchal, and women play a vital role in the health of their families. If the women are healthy and educated on how to best provide care for their loved ones, there is less chance of health-related diseases, particularly those that are preventable, such as obesity and diabetes. Mrs. Oleo agreed that women's health and education were important and added the component of consistent exercise and good nutrition. She stated that the Mexican citizens are increasingly less active and adopting a more sedentary lifestyle, and one is that are becoming more dependent on processed foods rather than natural healthy foods grown in the country. She and Mrs. One agreed and that a more traditional plant-based diet with very little meat would be beneficial to improving the health of the nation. Both rarely ate meat when they lived in Mexico, but enjoyed a staple diet of rice, beans, avocados, and fresh fruit, and they did not drink sugary beverages with meals. These factors that they considered These are the factors that they considered most important and most promising to improve the overall health of the country as Mexico and reduce the burden of disease. The conclusion. In conclusion of this overview of the health status of Mexico, it is important to remember that Mexico is working hard as a country with government initiatives and support to reverse the downward trend of the health status. While the burden of disease impacts the entire country, Mexico is taking measures to educate younger generations and families on how to better care for themselves. Mexico is a blended economy with funds for health care stemming from economic growth in manufacturing, agricultural, and tourism dollars. As Mexican citizens learn more about healthy practices, they decrease their chance of having a non-communicable disease like diabetes or heart disease. Mexico is a country of people who want the best for themselves and their families. Their collective culture and deep ties to the Catholic Church will provide them with a framework to successfully overcome barriers to good health and longevity. My references include the U.S. News, usnews.com, health data on Mexico, the World Bank, and the World Health Organization. The end. Thank you.